So
My ears?
Yeah. He says his hearing's not good, but if he takes that off, he can't really hear much at all.
How about any sinus problems?
Nope.
Breathing problems? Okay. Any oral problems or dental problems?
No.
Yeah, he's got a whole list of things that they want to do at the dentist. He had a tooth extracted about 6 months ago because it was completely decayed. And a bunch of his teeth are, they want to put crowns on them. But we keep saying it's not bothering him, so why would they want to spend $20,000 on his dental care? And we're like, oh.
If it don't hurt.
Yeah, so there's a bunch of things they want to do, but we told him to pump the brakes on that. He did have a tooth extracted not too long ago, though.
Well, I understand because every time you go to the dentist or a doctor or even the veterinarian, they want to do something. You can't get out of there without spending a lot of money.
That's right. And go back to the sinus thing. He does blow his nose a lot and has a runny nose, constantly.
Okay, so just generalized sinusitis.
Yeah, I wouldn't say he has
I'll say congestion.
Yeah, okay.
Okay. Do you hurt anywhere? Do you have arthritis or any pain?
A little bit in this knee.
That knee.
Sometimes. Not all the time. Depending on what you're doing.
And then his right shoulder. We had some injections done at the VA a few weeks ago where he had cortisone shot in his shoulder and in his knee.
Has that helped?
Yeah.
Good.
It does help, but it's temporary, right? It only lasts a few weeks.
Well, it's different. Because I had to have my rotator cuff done in my shoulder. Before I did that, I went to the doctor after, should have been a long time before I went, but they did a cortisone injection. And within 5 minutes, it was amazing.
Yeah.
And so that lasted several months
Mm-hmm.
and started acting up. So I went back for another injection. I'm like, this is going to help.
Mm-hmm.
2 weeks later, it was gone.
Yeah.
So every shot works different.
And I think it's where they do it, too, because, it's
Yes.
localized. Because I've had them in this shoulder, and, yeah, like you say, the first 5 days, it's like, oh, God, I'm back here. And then 3 weeks later, you're like, oh, there it is again.
There it comes back.
Yeah. So he fell and he broke his knee.
Okay.
And that's the side effect where he's got pain there. He fell another separate incident where he broke his shoulder. So he's got pain on that side, and we've, over-the-counter stuff. They didn't prescribe him any, pain relievers that would be a prescription style. Just give him ibuprofen or acetaminophen over.
Takes the edge off.
It helps, but I don't think he tells us that it hurts all the time, as openly as he
You're not
should.
a complainer, are you?
He definitely is not. Everything is 100% in his opinion.
Well, that's a good outlook. So, on a scale of 1 to 10, how would you rate your overall pain on an average day?
Pain?
Uh-huh.
I don't have any pain on an average day.
But when it does hurt, is it a 5? Is it a 2? 10's the worst.
Probably 5 maybe.
Okay. So sometimes it hurts and it's kind of like an aching pain.
Yeah.
Tell her about yesterday and your legs. Tell her what happened yesterday and tell her about that.
What happened yesterday?
You don't remember what happened yesterday? So his legs were bothering him so bad he didn't even want to get out of bed all day. All day. Literally 3 o'clock when the nurse came over, he was still laying in bed and said, I don't want to get up. My legs are hurting. I do not want to get up. So she reached out to me. I was like, look, he's probably legs are cramping because he hasn't moved all day. Because we got a camera in there. I can see what he's doing.
Mm-hmm.
And at 3 o'clock, he was still laying in the bed. I was like, well, he needs to get up and move around some. He's probably dehydrated and cramping because he doesn't drink very much because it makes him have to go to pee. And he's had some accidents. And just get up and go to the bathroom was a little bit of a challenge for him. Yeah. And, all of those other things. So in his mind, the less I drink, the less I pee, the less I have to get up and move.
Right. And I hear that all the time.
Yeah. So yesterday, he didn't want to do anything. Literally, I want to lay in the bed. I don't want to do nothing.
Do you remember that now that he's brought it up?
Yeah.
Was it a bad day?
It was just a good day.
That was one of your better days?
That's awesome. So how's your sleep? How do you sleep? Do you sleep good?
Yeah, we do.
No problems going to sleep or staying asleep?
Nope.
Okay.
He takes many little cat naps during the day. If he gets still, he'll nod off. And usually he goes to bed about 10 p.m. That's kind of his, all right, it's 10 o'clock, I'm going to bed. But then he'll be up and down all night long. Like when I spend the night here, I can hear him get up 3 or 4 times at night and go to the bathroom, come in here and get something to drink, or, just wandering around the house kind of, so to speak. And then he'll sleep till noon easy. Like he doesn't even want to get up before noon.
So you're not a morning person, huh?
Don't need to be.
That's right. You earned the right to sleep late, didn't you? Okay.
His excuse is, I ain't got nothing to do, so I ain't getting up.
There you go. I'm the opposite. I get up at 4:30 and I'm in bed by 8:30.
Mm-hmm.
How do you have any heart issues, Mr. Hatter?
I don't think so.
Any chest pain or swelling or shortness of breath? And
He's got high blood pressure and high cholesterol, and he's
is
got
that well controlled?
It seems to be every time we go, his blood pressure is pretty good. Usually in the 130s over 80ish. I think last time we went, it was 128 over 85 at the VA, something like that. So if he takes his medicine, it's in control, I think.
And no shortness of breath, breathing's fine.
He'll get winded if he goes, if we walk we walk down to the mailbox or we walk down the street. Some days when it's nice, we'll try to take a short walk and he'll have to stop a few times and kind of catch himself up. Yeah.
So it's exertion, not at rest.
Yeah, right here, I mean, he's
looking
fine.
right now.
Right, but if he tries to do more than, just walk around the house or, go up and down the stairs, yes.
Okay. So do we have any issues with cough or phlegm or any of those things?
I don't think so. At nighttime, I hear him sometimes cough, but I think it's just nasal drainage. When he lays down, it drips down the back of his throat, and it's kind of dry cough, but it's there. I hear him. But when he's sitting up like this, he doesn't. Never, hardly ever.
Okay. And you said there's been occasional urinary incontinence, but
Both. Number one and number two. Yes, I'd say.
how often in like a day or a week would you say that occurs?
So it's
Just
varies. I'd say probably twice a week.
Okay. Would that be with both?
Mm-hmm.
Okay. Does he wear incontinent products?
We do, like if we're going on a family trip or we're going out to eat or something, we'll put a diaper on. Around the house,
he usually knows, he just may not make it in time.
Correct.
Okay, that happens.
He prefers to wear the regular pull-up briefs, but when we're planning to be out of the house or a lot of activity or traveling, we put a diaper on just because.
Just because you don't know if you're going to get somewhere.
Right. Yeah. We'll take extras and change the clothes and stuff like that.
Right. Any recent urinary tract infections?
No.
Okay. All right. And stomach issues. Well, first let's go to the bowel movements. Are they normal typically, or constipation, diarrhea, anything that's a
Very
chronic
loose.
problem?
Very
So
loose.
That's
Very loose. Yes.
okay. Okay. Now let's talk about nutrition. Is he on a regular diet? Eat anything he wants? Or
He eats anything he wants. It varies on what he eats. Some days he will eat like an elephant. Other days he might eat like a mouse. It just depends on what's available and what's
whether
there.
he likes what it is.
Yeah.
Appetite good, fair, poor?
I'd say his appetite is good. It's not like it used to be, when he was younger, and more active.
He
But
doesn't burn as many calories.
right. Yeah. But now you put a plate in front of him, he's gonna sit there and eat everything that's on that plate till it's dry, and all the bone and everything. So he's an eater.
That's not bad. Let's talk about mental function. How do you feel about your memory, your decision making, things like that?
I feel pretty good about it.
Okay. You seem right on point with me today.
So his memory is a little bit slipping. Sometimes he'll ask who people are that he's known for a very long time, or what day of the week is it, what month is it.
No agitation or lashing out.
No, he's pretty
type behavior.
He's pretty laid back cat.
Awesome. So just kind of age-related, nothing specific there.
86 years old.
86 years young. Now, physically, taking care of your person, that's where the heart of this program likes to emphasize. So talk to me about the things you have trouble doing with bathing, dressing, getting around.
So he is very reluctant to take showers. We kind of have to make him.
Is it because you just don't want to, or because you're afraid you might fall? Is there a reason you're not liking to go to take a shower?
I don't like to take a shower unless I need it.
Well, with this program, and we're going to be here 4 days a week, you're going to need to take some form of a bath because it's required by the VA. Is that okay with you?
Yeah.
It can be a little sponge bath if you're not feeling up to a shower. But it's healthy to have at least 2 or 3 showers a week.
You hear that? 2 or 3 a week. Not 1 a week that's short, get in, jump right out.
2 to 3.
With soap.
That's healthy. That'll help you not have skin infections and it helps with pain and it just makes you feel better. After you're done with it, you're always glad you did it.
He does say that. He's like, I don't want to. I don't feel like it right now. It's always cold when I get out. That's his big excuse. It's cold when I get out. But after he gets in the shower and he does a proper length shower, not just get in there, turn around one time, wipe off, which he tried to do every occasionally. He's like, oh man, my leg feels better. Or,
it does help.
It
so
does.
We're going to encourage you to do that. But if you just feel like you're not able to take a shower, you can do a sponge bath. That's just a little bird bath.
Yeah.
Okay. Getting dressed, a little help with that.
Definitely needs help with that. I mean, he can do it, but it's a process.
It's a process.
Yeah.
The biggest problem is getting the socks on.
Well, we'll do that.
Yeah. And, pants and lower extremities are his problem. Shirts
That's
and
normal.
tops,
Can
no
you
problem.
button? You have good finger use? Okay.
Yeah.
Yeah, except we missed this one this morning, looks like.
Now, if we have an incontinent episode, does he need help cleaning
Yes.
and changing?
Yeah.
So I'm going to put down that we need at least help in checking during those episodes.
Absolutely. And then, sometimes he won't clean up after, like he won't take a shower after. He just had a blowout and it's everywhere. Oh, I'm just putting new clothes on and roll on.
I always check on my shirt when I change clothes.
Make sure you got it right. I hear you.
Yes, that's true.
You're not going to get anything by them, are you?
Huh?
You're not going to get anything by them, are you? You're going to try, though.
You're not going to sneak anything past us, are you?
No. Try to be on top of everything. I mean, try to be where I should be when I should be.
That's how I like to do things too. Sometimes it works out well, sometimes it doesn't.
Mm-hmm.
You just have to go with the flow, don't you? Okay. Now, the medications. How's that done? Does he?
I put him in that pill. I put him in that pill box over there, and I fill it up at least weekly. But he'll miss it a couple times a week if somebody does breakfast out. I put the pills right there beside it, and he'll take them. He's gotten into the road. David's gonna put them pills there. And when I'm eating my breakfast, I'm gonna take my pills. But if nobody's here to remind him, it'll slip his mind.
I don't know if I need them. Just take them.
Yeah, he says that these little pills don't do anything. They're too little to have any effect.
I'm going to take a minute to put them in my system. This might take a minute, so if you need to go to the men's room or just take a break.
You want to get up and walk around, show her how you get around?
It won't take long because you don't have too many.
Okay.
So I have a patient who I just admitted recently who had 5 pages. There had to be 30 medications.
Good gracious. That's
That's a meal.
I
yeah.
think I got some I don't need, but I don't know. If you don't know you need them, just take them.
Yeah.
And we've kind of got a little note on there about what to help him remember, why I'm taking this kind of thing. But most of the time he doesn't deal with the bottles. All he does is pop them out of that
That's
that pill
nice.
thing.
That's my pill man right here.
Is that what he's good for?
That's one thing he's good
One
for.
thing he's good for.
He's a good boy.
Well, you did good then, didn't
Taking
you?
good care of me. He picked me up from nothing and I fell through.
Oh
He's
my.
strong.
I
He's
bet
big
that
and
scared
strong.
him.
It definitely did, and makes you grateful that you stop by as frequent as you do, because sometimes you never know what you're going to
You
find.
live where?
Clayton.
Clayton. That's right, because it's storm day.
Yes, that's right. Yep.
And you come about how often?
I'm usually here. I probably spend a night, 2 nights a week, and I'm usually here in and out at least 3 days a week, whether it's weekends.
That's awesome.
Yeah, and it's my job is very remote, so I can work from here. It's not ideal by any means, but I can make it work out and make sure he's got everything he
That's
needs.
just when you have a parent in this age group that has some issues medically. That kind of job is awesome. What do you do?
I do. I fix computers. So
Okay.
I work for a company that makes ultra high-end computing systems and custom OSs for very large companies. And the company I support is Salesforce.com. So they're a global company. So I'm the one throat to choke, right? If something's going bad in China, they call me. If something's going bad in America, they call me. Something going bad in Australia, they call me. And then I just analyze the problem.
I'm glad it's you and not me, because I hate this darn thing.
Yeah, I analyze the problem and I send smart people to the right place with the right parts to make everything go away.
There you go.
Sounds pretty good to me.
It sounds great to me. So when I get this computer all out of whack, I know who to call now.
You can call me. I don't know if I'll be able to fix it or not, but we can definitely gather enough information. I can tell you what needs to be fixed, or I can get somebody engaged that can help us figure out what needs to be done.
I've got the ladies in our corporate office tell everyone that I am computer illiterate. I am actually technology illiterate. 'Cause I'm old. And they said, don't let her do nothing with that.
Just
Just
don't.
don't.
I understand that. It's funny, one of my friends at work, she's about my same age, she said, when I was a kid, I was fixing my parents' computers. Now I'm old and I'm fixing my kids' computers. I'm like the only one that knows what computers do. It's weird. And she's so right, though.
I'm at the place now where I'm making an assignment for our aide. So I put a bath or a sponge, or shower or a sponge bath. Do we ever wash hair? Is that something we want to add as
Shave.
as needed thing?
Yep, shave. And
Now he's on a blood thinner, so do we have an electric?
it's
razor?
a foil. Yeah,
So it's not going to be an issue. So
Yeah.
shaving, I don't like to assign anything shaving if blood thinners are involved, unless it's an electric.
Yeah, it's an electric rechargeable Remington waterproof
Perfect.
foil shaver.
Skincare, which is lotion, that's always a good thing.
Yep. Remind him to brush his teeth.
Okay.
Maybe an occasional fingernail clipping.
We can't do that.
You can't do that?
He's
Okay.
diabetic, so we can't clip. Now, if he
Now,
has
he's
a
not
sharp-
diabetic.
No, that's right. But we can't, even if people are not diabetic, we can't clip nails.
Okay.
We can, I can put nail
File
care,
'em?
meaning a file, if the nails are
Yeah.
longer. So I can do nail care, but it's not clipping.
Okay.
Let me go back to that.
Why is that?
If you need your fingernails filed, we can do that. We just can't cut them. And the reason is there are so many people that'll tell you they're not diabetic, and they might be and don't even know it.
Mm-hmm.
So we have to treat everyone the same. And of of course, we'll do the dress assist, even if that's just socks. And we'll supervise the ambulation just to make sure that there's no falls. How about making the bed, changing the sheets, laundry, things of that nature since he lives on? Doesn't need any of that?
We do that for him.
Okay.
We have to assist with that. Now,
we will clean the bathroom up after the bath.
Uh-huh.
And I'm going to put empty trash if there's any incontinent products that need to go out.
Perfect.
Clear pathways, minimize clutter, just for fall precautions. And supervise ambulation. And is there any meal assistance? Because this is right around supper time.
Yeah, so that's one thing that we definitely need help with. He's not a microwaver or cooker at all, so usually we'll have a plate prepared for him and just set it right here, and when he's ready to eat it, it's there.
So if there's a light meal, like we need to heat up some soup or make a sandwich, stuff
But
like that.
throw a bag of popcorn in, heat a can of soup up, or heat one of the, like right now there's 3 or 4 plates in there that are ready to eat. Throw it in the microwave for 2 minutes, give him a fork and knife, set him right here, and he's good to go.
Okay.
But as far as carrying it from there to there and that kind of stuff, that would be a little problematic.
Right.
Especially if it was hot.
Does he take medications during this time that we would need to remind?
Everything we take is all at once, and usually it's the morning. But if he forgets it and you notice, I guess, I don't know what the right thing to do is.
I'm going to put remind.
Remind.
And then I'll instruct that means just check the pill box and make sure that the slot's empty.
Yep.
Okay. Well, I have an idea, and this is a starting point. So what we've assigned basically is the bath, the dress, the meal, the ambulation, the toileting if an occasion is needed.
So tell me what ambulation means. Just getting around? Is that mobility kind of stuff? Okay.
And we can't go off site with him, but if he's walking in the yard, we're gonna walk in the yard with him. If he's walking up and down the hallway and we notice that he's unsteady, we're gonna walk with him. So we're not gonna make a baby out of you, but we're gonna try to keep you safe.
So that's great because he does like to get out in the yard, especially on a day like today or when the weather's warmer. He will go outside and sit in that chair for hours on end and walk, around the yard. And
yeah, I saw him when I drove up. I said, I see him out there. I know it is. It's a pretty day to be out, and these nice days are limited for a while, so we enjoy them, right?
It's going to be good. After that, it's going to rain this day.
It
rain and cold.
Is.
Rain and cold. Yep.
Okay, we're getting there. How tall are you?
About 5'11".
He used to be. I'd say he's about 5'7" now.
Okay, and about what do you weigh?
160. You said what height?
About 5'7". You're about as tall as I am.
Now, I'm going to run to my car because I forgot to bring my bag. I want to check your blood pressure, so I'll be right back.
Okay.
I saw David and forgot my stuff out in the car, so give me just a second.
You can pull up in the driveway if you prefer
I'm good.
to.
Thank you, though.
All right, you want a glass of tea or something?
No. This is pretty painless.
Well, you need to tell her what your challenges are. You can't get up and down out of the chair. You can't get out of the bed. You can't tell her, no, I don't have any problems. Everything's great, because then we're not going to get any help. You're not being... I think you're just wanting to hurry up and get through this versus thinking about your answer.
She asks me a question, I give her an answer. I'm not sure I'm giving her the right answer.
Well, see, that's the concern. You need to think about it. You don't just pop up and say no or yes. You got to kind of think about it for a second.
All right, young man. Let's see what we get with your blood pressure.
I was getting ready to mow the grass this afternoon.
There's no grass out there, Pop. The grass is dormant right now.
I think you got a good one here getting those leaves up. While that's working, I'm going to take your picture for my chart.
Is at the same level as your heart. Do not move and keep quiet. Now, if you are ready.
Right here. Good.
You know what I just realized? Today's December 17th. You know what happened on December 17th?
Nope.
So that's that quick answer I'm telling you. You got to think about stuff for a second. You don't remember what happened on December 17th? It was the day Mom passed.
Oh.
Maybe we should go to her site when we're done here. Go pay her a visit. I'll drive you over there. It's too nice a day to not.
Got it buried in what do you call it?
Columbarium is kind of like a mausoleum.
Mausoleum, 108 over 81. That is good. Pulse is 99.
What'd you do?
So your heart rate is 99. Your blood pressure is 108 over 81.
Okay.
What's good?
That's not bad at all.
So typically, 120 over 80 is what is like the recommended.
That's what they say, but
Right.
I hardly ever see that anymore. I think in general the population's blood pressure has gone up.
Mm.
I'm seeing a lot of, 120, used to be 120 is now about 140. 80 is now about 88, 90.
Yeah.
So,
Oh, I have high blood pressure too, and mine's yeah. And the day that they determined that I needed to start taking something, I thought that little CNA girl her head was going to spin around because she took my blood pressure and it was 170 over 110.
oh,
And
that
she's like,
110 is not a good number.
she said, "Are you feeling okay?" I was like, "Yeah, I feel fine." What's the problem? She said, "Hold on a second." She said, "I'm going to go get another blood pressure thing." And then she brought the doctor in with him, and he did it with
the old-fashioned kind.
and it was like, "I'm going to write you a prescription. You leave straight from here and you go get it. Don't go."
Take it before you leave the store.
Yes. And ever since then, we've adjusted it some, and it's been real good since then. But I didn't even know
You
that.
had no symptoms. Well, you got lucky.
I guess that's why they call it the silent killer, because I had no idea. I had zero idea.
So, David, if our aide is here and he takes a spill or something happens, who would be the first person you'd want called? I guess the quickest person who could get here.
So my brother probably.
Okay, and
because
told me
he's
his
local.
name. Tell me
Danny.
Danny. And his phone number. Tell me one more.
252
Mm-hmm.
245 1905.
And I put that number here because this folder is going to stay here, and our aide knows to grab that and do that.
Okay,
So,
all right.
And then would he be corresponding with you and your sister?
If he answers, yeah, he would definitely.
Do you want to leave your number?
I would.
I'm
Yeah.
going to put him in number 1,
Okay.
and you was number 2.
Okay. 919-730-4749.
Okay. And that between the two of you,
Absolutely.
that would work.
Yeah.
Okay, what I'm going to do now is get together some forms to sign for my chart. Everything you're going to sign here, there's a blank copy of that exact document
review,
here, so you
okay.
can have it for future reference.
Gotcha.
These don't have to be signed because it's just, but know that everything you're signing for me, there's that.
Okay.
Do you want to sign, Mr. Header, or do you want David to sign for you? Your decision.
Do you want to sign all
There's
this
about
paperwork, or
8
you want me to just sign it
pages.
for you?
I want you to sign it, but I want to know what you're doing.
Okay.
Exactly. I don't blame you.
That makes perfect sense, and that's fine.
This first one is about HIPAA, and what you told me there were no restrictions.
So HIPAA is the health information privacy stuff. So what we're talking about, she can't go and talk to anybody else about it. So it's your information, it's private, and nobody should be sharing it without your knowledge.
Yeah. And the second thing we're going to sign talks about rights and responsibilities. Basically, you are the patient and the family. Y'all have rights, and the rights include good communication from us, good care, the right to make changes, the right to stop the service, the right to change the care plan or the schedule. Those are examples of your rights. Your obligations to us, again, is communication. If he's not going to be here on a day scheduled for care, call the office in advance to notify us.
Mm-hmm.
If he's hospitalized, if there's a communicable disease in the home like COVID or flu, let us know so we don't send the aide out here to take it on to the next patient.
Right.
If you don't like the aide we assign, you're not stuck. Just tell us, because sometimes personalities may not match well. And if we don't get it right, we need to know so that we can begin the process of a replacement. So nothing is firm here. It's all fluid and to meet the ongoing needs. The next thing is about safety in the home. So you told me there's nothing out of whack or unsafe or in non-working order. We don't expect perfection, but if it's a safety hazard.
Yeah, nothing that I can think of. I mean, all the appliances work, water works, toilet works, shower works, doors lock. I feel like that's the big stuff.
That's the big stuff. The next thing is about this thing right here. This is a CPR face shield. We talked about DNRs. If we have a DNR, I don't leave that because I don't want there to be any confusion about whether or not to initiate CPR. Mm-hmm. So without a DNR, I leave that in case the aide is put in a position where she has to. She put that over his mouth. Mm-hmm. It's a protective barrier.
Oh, so it would be when they try to give him puffs, it's a
protection.
I got you.
Yeah.
I got you.
But if he ever decides to get a DNR, I need to know to remove all that, because then we wouldn't.
What's a DNR?
Do not resuscitate. And what that would mean is that you would determine and have an order that says, if I stop breathing, don't even try to bring me back. That's a DNR. And nobody makes that decision but you and your family. But we need to know about it if you make that decision, so we respond appropriately.
So you get that? So if you're in a really bad health incident and you are unresponsive and you're not breathing, do you want them to start giving you chest compressions and blowing in your mouth and giving you other medical needs, maybe an IV or some other type of medication to try to bring you back to your normal self? Or do you want to say, hey, obviously this is something bad and I'm just going to let it take its course, and if I get better on my own, excellent. If not, I might pass. I'm okay with that too. And this is something you can think about. We can talk about it with Jackie and Barbie, the more medical people in our family, and let you think about that.
There's a lot of literature on those decisions and where you want to stop the assistive process. So I encourage you to sit down as a family.
We need to talk about that more.
Wait till something happens. You want to be on the same page.
Yeah, I think we need to talk about that more and let you think about it a little bit. Because sometimes if you do those things, you might not come back and not be as good as you were when you had kind of like when you had your stroke. If it happens again, do you want them to take you to the ambulance or let you just kind of fade away? One of those things you got to think about. We'll talk about it more.
So, emergency preparedness. If there's something like a hurricane or something, does he usually remain in the home or go somewhere else? Okay.
Yeah. Or either he will come with another family member to where the safest place is, right?
And there's transportation on.
We would definitely come and get him. Yeah.
Our policy on emergency preparedness is that we grade our patients based on need. You don't want to be at the top of that list I have. And you're not. That's a good thing. Now, somebody lives out in that say they're bedbound, they live out in a rickety old country house with a 200-year-old tree over it. Excuse me. They're kind of more needy than y'all.
Get it.
So they're my priority. But our policy states that we do make everyone aware of stuff, because we have patients that never watch TV or don't care about
or don't know that there may be an imminent danger.
Don't know. So we always reach out to people in a zone that's kind of determined to be at risk.
Gotcha.
And we check on them afterwards. But we always tell everyone, don't count on us as your resource. We might not be able to get to you.
Gotcha. Okay.
And then EVV, electronic visit verification. You're going to like this part.
Okay.
How our aides do their documentation. We have an app that's a secure app that they'll have on their phone. When they arrive, they'll click in. It's coordinated with the address, and it's GPS located, so that when our aide is here, we know they're here.
Right.
When they get ready to leave, they'll clock out, and they'll require a signature. It keeps everyone honest and accountable, and it's also a safety feature because we know where our aides are.
Right.
And back in the old days, people would say they were there for 2 hours and they'd leave after 30 minutes and put on the paper what they wanted to put on it. Nobody ever knew the difference.
I
We
get
know
it.
the difference now.
Yeah.
So that's how we do our visit verification. I'm GPS located here right now, so when I get ready to leave, you'll sign me out on my computer.
Okay.
And lastly, there's a law in North Carolina that caregivers may not smoke on your property. It's illegal.
Okay.
So I have to tell you that.
Okay.
So I've got everything here that requires the signature. And again, David's going to sign these, Mr. Hatter, but everything he's going to sign, this form is in here. And I'm going to leave this with you.
And we just talked about them.
Yeah.
It's all those papers that I'm going to sign here. We just talked about them. And we can talk about that DNR stuff more when you have time to think about it. And Jackie or Barbie can give you better details than I can because I'm not real versed at that. All right.
All right. You'll see an X, but I'll point to it. This just says HIPAA, that there's no restrictions.
Yep. So no restrictions that some stranger, she's not going to give your information, or the person who comes and works with you, you're not going to share your health information with anybody outside the family.
And turn that one over because that's got a backside
Okay.
that says I'm giving you a copy of our policy, and it's in here
Okay.
on privacy. And just hand me that one. That's the one where you talked about rights and responsibilities, our obligations to y'all and y'all's to us as far as communication.
Right.
But
So this is kind of the one where if you're not going to be here, or you're at the hospital, or you're at a doctor's appointment, and they're scheduled to come by, we got to call them and say, hey, let's skip today because he's not going to be home. We got to be a good
communicator.
good resource person.
And we have to communicate with you too. If our aide we know is going to be out that's sick, we'll call you. And you want me to call you or David for that kind of situation?
Probably me.
Okay.
Yep.
For scheduling issues.
Mm-hmm.
It probably won't be me, but you will get to know the people in our office that are our scheduling coordinators.
Okay.
That just says there's no safety issues in the home that you know of.
Yeah, let's say that your home is safe for visitors to come in, and
Our caregiver and
there's nothing broken in here. They're not going to come in here and put their foot through the floor, or
and
the roof's going to fall,
instances.
and the roof's going to fall on them or anything like that.
And that's the one that lets me leave that face shield unless there's a dent on it.
Okay. So that, yep.
And that one goes in my book. It's about the emergency preparedness. It may not be complete, but I'll fill it in with the other emergency people.
Mm-hmm.
And it just says that it will be in case my computer is not able to be brought up if I need to check on you before or after an event. So it's just a backup for me. And that's our policy. Like I told you, we have to grade our patients on need. And it just says that what our policy is on emergency preparedness.
Yeah, so if there's a hurricane coming and you need to be evacuated or something else needs to be done, they're going to call you and say, hey, Mr. Wayne, do you have plans already? Or they're going to call me and say, who's taking care of Wayne when the weather gets terrible? And I'll say, I'm going to be over there and I got him. Or I'm out of town and somebody needs to go check on him. Or something like that. And it'll be on us to tell them what's going on.
Right.
But they're going to remind you that
Something's happening.
Yeah, because we always know when the hurricane's 3 or 4 days before it gets here, you got time to kind of get ready.
And that's the one that talks about how now,
Electronic.
Mr. Wayne, when our girls are here, they're going to ask you to sign their phone when they get ready to leave, and that's how we do our documentation. So it tells us and it tells the VA that our aide came at whatever time and left at whatever time, and she'll document the task she does for you based on what we've assigned.
So it's a little different than how Miss Sheila's doing it now. You know how she writes down on the paper, I did the dishes, I gave him a shower, I cut his hair. She writes it on that little yellow pad. Their people are going to have an electronic version that's on their phone, and they're going to say, Mr. Wayne, I washed your hair, I cooked, warmed your lunch, I did some dishes, and I made sure you made your medicine. And then you're going to say, yes, she did that, and you're going to sign, and then it'll know the time that they left. So she can't say that I was here till 8 o'clock, but she left at 6.
It keeps our girls honest.
It's kind of like the time clock at the feed mill. When Stan Hicks comes in at 7 o'clock, he punches the clock right there and he puts the thing back. And then at the end of his shift, he comes and punches it again. That's exactly what this is, but a modern version of it.
It's what the VA requires. And that's the no smoking notice.
And this one is saying that nobody that comes over here to give you aid can smoke on your property. Cigarettes or vape pen things.
Really?
Yeah.
They cannot.
No smoking.
No smoking allowed. Do you have any questions?
What if he smokes?
He's allowed to. He's not my employee. Unless you get on him about it.
I don't, but my brother does.
Okay. Well, here's your folder, Mr. Wayne. This is our information on the front here. Our office number. And David, you can take a picture of it. And
I'm getting ready to just stick it in here in my phone.
Okay. That's our Wilson office. You've been getting phone calls from me from the Smithfield office because that's where I primarily work. But I live in Wilson, so I come back and make visits and do stuff in the afternoon.
Action Hill.
Uh-huh.
Where do you live?
I live on Canal Drive.
Oh, just down the road
Down
then.
the road.
So this is
This
the
is
normal.
8 to 5, Monday through Friday, and the after hours it's a cell phone that we switch with, or everyone takes turns within the 4 offices.
Mhm.
So it might not be the person you're used to in this office, but they get the information to the office.
But somebody will pick
Somebody,
it up.
if they don't, call them back within 10 minutes. If they don't call you, right back.
I'm gonna put that one as the pager then, and then
Yep.
the main is.
The 24305.
Yeah. Okay.
Now, inside your folder, all those things that David just signed are right here. This is if we have to do CPR. This is if you want to learn about a shelter. This is information about our agency, and this is our policy on privacy. And this is my business card. If you want to take a picture of that or put that in, that's my cell number. I don't typically answer it right away because I don't answer it if I'm in a patient's house.
Mhm.
But you can leave a message on that.
Oh, so I've got you at that 1150 number,
That's
which
where
is
you can reach me mostly, and you can certainly leave a message with whoever answers there, and
Okay.
they'll get with me. But
Okay.
that's just if you need me for any reason.
What's this?
That's if they have to do CPR. Say you stop breathing, and they need to start CPR until the emergency department could get here. They would put that over your mouth, and that way there's no saliva transfer, so it's a protection if they have to breathe into your mouth. That's only for an emergency.
So it's like a handkerchief, and they put it between your lips and the person who's going to give you CPR's lips, so that you don't get their germs and they don't get your germs.
Right.
It's kind of like wearing a face mask for COVID, but this is only for CPR and mouth-to-mouth resuscitation.
We hope that stays right there forever and never needs to be used.
Yeah. And we can read over this later on tonight. I know you're going to pull this out and
Absolutely.
look through it and get familiar with it. And if you
I
got any
want you
questions,
to. That's why I give it to you.
I'll help you with it.
The one thing I have not given you is his care plan, which is the assignment sheet, because it's in here and I have to print it out.
Okay.
And I will get it delivered either through the aide who comes or by myself before, or at least right away when we start the service.
Okay.
And do you have a specific time you want to start, like as soon as possible? Right now with the holidays, I'm hearing a little bit of wait till after Christmas and just a little bit of this and that. So what is your preference?
Today's Wednesday, is that right? No, Tuesday. Today's Tuesday, the 17th. And then that means Christmas Eve would be next Tuesday.
Yeah.
Let's start it on what day is? Let's see. Because I'm probably going to be here most of next week. I'm on vacation
Okay.
all next week.
So Monday, Wednesday, Friday, and Saturday.
Yeah, I think that's
So
a
it
good
would-
start for us.
Wednesday would be Christmas, so Friday would be the day after, the first day we'd be assigned after.
So, can we do that? Start on the 27th?
Mm-hmm.
Okay, let's start on the 27th. And that'll give us a little,
Time to review and to talk with your
Yeah.
family.
Yeah.
And then you can touch base with me with any concerns, questions, or changes.
okay.
Now, our staffing coordinator at the Wilson office is one of two people you'll be talking to about staffing. Anything related to the aid schedule or canceling a visit or anything question-wise with that, that's Tracy Taylor and Juanita Jones.
Okay, and they'll be at this number?
They'll be at that number,
Okay.
Juanita Jones.
That name sounds familiar to me, Juanita. But I don't
And
know.
they're the primary staffing coordinators in Wilson. And so when we get this schedule, and I'll talk to her about everything, what I've done today, and kind of go over the particulars with how he is, and likes and dislikes and all of that. I'll hand that information off to the staffing coordinators, and they will determine and who's going to be able to come at as close as we can to the assigned time.
Right, and we had like 3 to 6. Is that what we had?
Yeah, I believe. Let me look just to make sure. 3 to 6.
3 to 6.
Uh-huh.
Okay.
And it may not be exactly, because if I
I
got
get it.
somebody who can come at 5, or if somebody can come at 6:30, or 3:30, we're going to do our best to get it as close as we can based on our availability of
Okay.
caregivers. And one of the ladies will call you in advance and tell you who it is.
Mhm.
When she comes, she'll have a uniform. She will have a picture ID that'll match the person we tell you.
Mhm.
She will have gloves, and she has access to masks.
Mhm.
So if anybody's not feeling well or sniffling, we do provide all of that.
Okay.
You do not give her anything. No money, no gifts.
Do you hear that?
This is not required. This
Right.
is taken care of. We pay everything that they need to do their job.
Okay.
If you don't like who we send, just get with me,
Okay.
and we'll go through it. We'll work on it together. Okay?
And you may need to give them more than one chance too. Not everybody's going to
you
be on
gotta
their
get
best day
used
the
to
very
each
first
other.
day.
But if you determine this is just not going to work out, then that's okay.
And it may go the other direction too. They may say he's a needy old fart. I don't want to have to deal with him.
And that's okay too. So we don't make anybody work anywhere they don't want to, or you accept anybody you don't like. So that's just one thing we got to work on together. Now I want you to sign me out, because I need to know what his signature looks like. So you do it wrong.
So we talked on the phone. What are your thoughts about the allocation of the hours that we have? Do you
I
think
think
we're
let's
about right?
start with it. It seems not with the pen, with your finger. Right in here.
In that light colored box.
Just do your name or however you like to sign.
Wayne C. Header. You just put your finger on there right like that.
And if it don't work out, we'll erase it.
Yeah, we can
Oh,
always
you
start.
got it.
We can always start over.
Good. Look at that. It usually doesn't look that good. You can just put your last name if you want to. Tip of your finger. There we go. There we go. That's starting to look normal. Now I'm going to hit save. So see, now I know what your signature looks like. Okay. Good job. All right. So Mr. Header, what we're going to do now is I'm going to discuss with our staffing coordinators and pass the ball to them so they can find a good person for you. And then we'll give David a call and let him know about the start. And he'll be here the first day they come. And she will have a care plan that tells her what you and I and David decided we want her to do. And if we feel like it needs to change, then we can work on that in the future. I have to make a visit with you every 90 days. So that's quarterly. And I will call David in advance of my visit time and work out a schedule where I can come. Now, most of the time I need to come when the aide is here so I can observe the interaction.
Yeah, that'd be fun.
But, you know, if we need to do a visit without the aide here at any point in time to discuss issues, we can do that too.
Yeah. And like I say, I'm pretty flexible because I'm here several days a week anyway, so we can work it out.
And we'll make it work.
Do you have any questions for Miss Sherry?
No.
Okay. Well, y'all talk about it, and if you think of any, you can holler at me. And I want to wish you a Merry Christmas, because I won't probably see you till after that. Okay?
That's only a week away.
That's a week away.
Exactly a week away. Yep. Christmas Eve is
Got that.
exactly a week
Well,
away.
you get outside and enjoy this pretty weather while we got it.
I think we should hit the restroom and go visit Mom.
That sounds like a plan, too. Well, I'm going to head out. It's nice to meet you, Mr. Hatter. I look forward to seeing you again soon, okay?
Okay. See you next year.
You will. You sure will.
All right.
David, thank you so much
Thank
for
you.
assisting me.
Yep, no problem.
And call me with questions. We'll be in touch.
Sounds great. So you should have showed her this and trying to get up deal. She didn't see all this.
They're sitting for a long time like that. You get up.
When you sit in your big chair on the couch much longer than that, we only sat down for about 30 minutes.
Now what she's doing here will not affect the